again, Dr. K here from Providence. Today I'm going to talk to you about setting up a proper workspace at home. So if you've been working from home during the pandemic, if you have been distance learning, I know a lot of my patients have been working on their laptops, either in their bed or on their couch or setting up at a dining room table. Today I'm going to talk to you about how to set up the proper workspace for you. So first, you want to be working either on a desk or a table that doesn't have drawers in between where your legs and your arms are. You want the ability to move your legs around. Second, I would invest in a comfortable chair. And the chair should prop you up in a proper posture with a little lumbar support, but it should also give you a little back extension. We don't necessarily want gravity to be pushing straight down on the spine for hours on end. So a little back extension that helps to open up the hips as well is good. We don't have chairs that have backs here because we adjust our patients in the office, but ideally you want a chair with a back that's going to put you up in a proper posture, but also allow you to open up your hips a little bit. And you want to be able to adjust the height of the chair, not necessarily for where your legs are, but for where your arms and your wrists will meet your keyboard. So your arms your elbows are bent, but your wrists are going to stay straight. And your keyboard should not be angled to you. It should be either straight or angled away from you. That's going to help to keep the wrist straight. I'm not a huge fan of the rest for the wrists. If you like to use them, make sure that you are putting your palm over them and not necessarily the wrist themselves. I've seen patients develop carpal tunnel symptoms because their wrists are directly over it and are becoming compressed. So just be careful with that. From there, you can adjust your legs. So if you want to kick your legs out a little bit, some people like to use footrests or a little bolster to rest the feet on. That will actually help to open up the angles of the knees and the hips. If your feet are comfortable flat on the floor, great. And then from there, ideally that computer screen is at eye level with you. And whatever you have to do to adjust it to get it as close to that as possible, the better. Here we've just used a little bin to prop it up. If you have a laptop, you want to prop up the laptop, and then I'd recommend using a separate keyboard. If you are somebody that has two computer screens, you want to angle them in such a way that you're able to turn your whole body to look at each screen. You don't want to just turn your torso, and you don't just want to turn your neck. You want to get in the habit of turning your whole body. This is going to save you from straining the muscles in both your neck and your back. And lastly, but probably one of the most important, is that you want to bring the mouse in as close to you and as close to the keyboard as possible. If the mouse is out here on a different planet, it's going to really create some shoulder pain or some neck pain, and we don't want that. So try to bring your mouse in as close to you. They also have keyboards that are a little bit shorter now that don't necessarily have the numbers off to the right, because really, do we need the numbers in both places on the board anyway? I don't know, but it allows people to bring the mouse closer to them. Okay, so really this is also about creating proper habits. It's about getting up every 15 to 20 minutes, ideally, even if it's just to stand up, do a little dance or walk around your desk or walk around outside. I have patients that have been investing in the standing desks. That's really great, or their companies will buy them for them. It really helps them to split the time between standing and sitting and creating those proper habits. You want to do some stretches before you start to feel tight. You want to drink water before you start to feel thirsty. Creating those proper habits for yourself to help keep yourself well at this time. If you have started to develop some pain in your back or in your neck, you want to talk to your chiropractor or be getting adjusted every once in a while. That's really going to help to keep your body moving properly and to help keep you well.